Hello, everyone. So we welcome to the second seminar for the BERD seminar series for Spring 2022. Before we get into the interesting discussions, I want to remind everyone that the webinar will be recorded automatically and all participants are muted. So if you have any questions during the seminar, please type in your question in the Q&A box and I will help the speakers monitor the questions. And the slides for this seminar will be available to you after the seminar ended today. So we have two speakers today, Dr. Lisa Davis and Dr. Kyle Kopko, who is going to talk to us about how Census 2020, what Census 2020 means for the rural health in rural Pennsylvania. So Dr. Lisa Davis is an outreach associate professor of health policy administration at Penn State, and she also serves as the director of the Center for Rural Pennsylvania. And Dr. Kyle Kopko is the executive director of the Center of Rural Pennsylvania. So without further ado, I'll let the speakers take the virtual floor. Lisa, Kyle, take it away.
I think Kyle is going to go first, so I will turn things over to him.
All right, thank you very much. I'm going to try sharing my screen here. Is it all right if I have screen sharing turned on? I keep seeing a message that others need to stop screen sharing here. There we go. Here, let me try this now. All right, can everyone see that? If I could just get a thumbs up, that would be fine. Perfect, perfect. All right, so hello everyone, good afternoon. My name's Kyle Kopko. I'm the executive director for the Center for Rural Pennsylvania. And I'm very, very happy to be with all of you this afternoon and also glad to be joining my great colleague, Lisa Davis. My portion of today's discussion is well, probably the longest title I've presented ever. What we know from the Census 2020, what we don't know but we'll know soon, and what it all means for rural health in Pennsylvania. So very concise. There must be an acronym that I could use in there somehow, but I haven't figured it out quite yet. So I'm going to dive right in here, and these slides will be made available. Feel free to reach out to our office here at the Center for Rural Pennsylvania, rural.pa.gov. We'd be happy to send those around too. So just a little bit of background. The Center for Rural Pennsylvania is part of the Pennsylvania General Assembly. We are considered a legislative service agency. We basically have two primary functions. First of all, we administer a grants program for faculty members to conduct applied policy research, which is supposed to inform the actions of the General Assembly, but also for county commissioners, municipal leaders, school district officials, so on and so forth. So anyone who's affiliated with Penn State is eligible for our grants program, including any of the regional campuses of Penn State too. We're going to have our new RFP coming out in March. It'll list a variety of targeted topics, but we also have an open call for topics too. So for any faculty, if you have a public health related topic that you think would be good in terms of applied policy research, reach out to us. We'd love to have that conversation with you, and we can get into more details there. We also maintain a comprehensive statistical database on all different types of rural conditions and indicators. That's maintained by our senior policy analyst, Jonathan Johnson, who's on the line here as well. And he's responsible for a lot of the data put together here today. So thank you, Jonathan, for that. And then we also have the ability to host legislative hearings, and we've tackled a variety of issues in recent years, anything from the opioid pandemic. And by the way, we are having a hearing on that tomorrow. If you want to register for that at 9:30, the Attorney General and several cabinet level secretaries will be speaking. Broadband access, COVID vaccines, rural aviation. There's so many different topics that we've tackled as a center. So I want to just give a quick overview of what we're going to be digging into here today. Obviously, with the census being released, it's not really a complete census database, at least relative to what we've had in previous decennial census. Yes, we do have data that was released. We do finally have redistricting data for congressional redistricting purposes, but the summary data file is delayed. We're not sure when that's going to be coming out yet. And the 5-year ACS, that's the American Community Survey, which is part of the Census Bureau, they're looking at least a few more weeks until they can get their new 5-year ACS data out. Now, what do we know already? We can tell what is rural based upon our definition. I'll talk about that here in just a little bit. We know about changes in population characteristics and where they are geographically throughout the Commonwealth. And we know some information about households and housing units. But what we don't have complete information on, among other things, are age cohorts. We do have some very basic data above and below 18 years of age, and we'll get to that a little bit later. And there's some other housing and household and housing characteristics that are being delayed. We're just not sure when those will be out in their entirety. This is all something that the Census Bureau is still working on, so it's going to be a little bit longer yet. So let's start first of all by talking about what is rural within Pennsylvania and how has it changed over time. So here's a map of rural Pennsylvania. This is our county definition. We have definitions for rural counties, school districts, and municipalities, but the county definition is the most popular one used for statistical analysis purposes and also for some public policy purposes as well. It's based on population density. That's the quick takeaway. The average population density is kind of the line of demarcation to determine whether or not a county is rural versus urban. So 290.6 persons or 291 persons per square mile is the average population density. If you're below that threshold, we categorize that county as rural. Above that, it's considered an urban county. And you can see here, basically 3/4 of Pennsylvania's landmass is rural. Anything that's shaded in green here is a rural county that falls below that threshold. And we're talking roughly about 3.4 million people also. And just to put that in perspective, rural Pennsylvania, those nearly 3.4 million people, that's bigger than 21 states and the District of Columbia. So we're talking about a pretty sizable population overall. And Pennsylvania actually has the 3rd largest rural population out of any state in the union behind Texas and North Carolina. All right. Let's talk about population shifts now over time. And again, all these slides are going to be made available in advance. So if anything goes too quickly, we can get that to you at a later time.
Can I ask a quick clarification?
Sure.
The rural urban definition, the cutoff, is it the same for all states?
No, that's a great question. So this is something that we've developed in-house as part of the Center for Rural Pennsylvania. And we've also been able to apply that to other states for research purposes. Without getting into the weeds too much, there are many definitions of rural, and it depends on which government agency you're interacting with. There's at least 7 different definitions at the federal level. It depends if you're working with the Department of Agriculture versus the Department of Education, the Office of Management and Budget. They have different variations, different scales. So it really depends. We actually have a whole presentation on that alone. So happy to talk with anyone else about that too. It's much more complicated than what folks might originally anticipate. So as you can see here, based on our definition, we've broken down population change going back to 1920 between rural and urban. So the green bars here represent rural Pennsylvania. So you can see there's a slight decline in rural Pennsylvania's population going from 3.47 million in 2010 to 3.38 in 2020, so rounding up to 3.4 million. But consistently over time here, we see that urban areas, I'm going to use my laser pointer here. You see it's an upward trajectory for much of our urban counties. So they're growing in size, and there's basically stagnation of population within our rural communities. Now, where has this growth occurred? That's what this next slide shows. Any of the shaded counties here are those that experience population increase. For the most part, population increase has been occurring within the southeast corner of the state. And so this is what we refer to as the bifurcation of Pennsylvania. Basically the southeast versus everything else. Now, what's interesting is this closely follows the I-81, I-78 highway transportation corridors that come up from Maryland and across and through New Jersey. So you can use that as kind of a rough outline to determine where population growth for the most part has happened. But there are other pockets of growth too. Since we're having a presentation here at Penn State, obviously Center County has experienced growth over time. We also see some of this happening in the western part of the state and to some extent in the Northeast. I'll note just in passing, this is something for another time, but we do have some evidence that after the census capture date, there was increase in housing sales in the Northeast part of the Commonwealth, particularly folks moving from New York, New Jersey, and the suburbs of Philadelphia, presumably in reaction to the COVID-19 pandemic, but all that would have been after the census capture date. Now, even though much of rural Pennsylvania here has seen population decline over the past 10 years, I want to emphasize this is not strictly a Pennsylvania phenomenon. This is really happening to many rural counties all throughout the United States. And you can see this here on the national map. Any of these counties shaded in blue would have experienced either a population decline or no population change since the 2010 decennial census. So what we're seeing in rural Pennsylvania, that's also occurring in counties along the New York border, Ohio border, much of West Virginia, and western part of Maryland as well. So again, it's not unique to Pennsylvania. So this isn't a trend that's the result of any particular administration or any particular policy. This is really a long-term phenomenon that Pennsylvania and much of our region has been grappling with for some time. So how has population change affected our municipalities? So the population growth that's occurred in rural Pennsylvania is primarily happening in townships. And that's what this bar chart here illustrates. So going back to 1960 through 2020, you can see at the top here, the total population for rural Pennsylvania, just over 3 million in 1960, 3.3 million in 2020. The yellow bars here, these are our townships. So that's primarily where folks are. We see a declining population in rural boroughs. So when there is growth, it's mainly happening in townships. I want to speak now a little bit on some demographic characteristics, particularly diversity and how that's changed over time as well. Obviously, this is going to have implications for public health, and we'll get into also the aging of population in just a little bit. In the upper left, this is Pennsylvania as of the 2000 census. The number of people of color, one dot represents 10 people. So there's about 1.9 million persons of color in 2000. That changes to 3.4 and some change as of the 2020 census. So this is a pretty significant shift. And you can see that this is even occurring in rural communities all throughout the northern tier, the central part of the state. So rural Pennsylvania and Pennsylvania as a whole is becoming more and more diverse. And just to better showcase some of this change here, what these pie charts demonstrate is change between 2010 and 2020, so 10 years worth of change. In 2010, number of people of color in rural Pennsylvania itself, they constitute about 7% of the population. That almost doubles by 2020. So now people of color make up 12% of the population in our rural communities. And we break this out a little bit more. Some of the most significant growth occurred among individuals who identify as 2 or more races. We have actually a decrease in the percentage, the raw number goes up, but a decrease in the percentage of Black or African Americans, and a slight decrease in the number of or percentage of Hispanic and Latino. So really the growth here is happening among those individuals who identify as 2 or more races. So I'll move on here to household sizes. what I think is an interesting trend, something to keep in mind, this is going to relate to age and household characteristics. The number of rural Pennsylvania households has increased steadily over time, okay? So just under 1 million households in 1970, but by 2020, we have 1.37 million households. But the average number of persons per rural household declines during this exact same time. So in 1970, on average, about 3.1 individuals per household. We're down to 2.3 roughly in 2020. So yes, we do have more households overall, but the number of people living in those households is decreasing. So let's talk about housing units. What does this mean? So you can see housing units increasing over time. The green bars here are occupied housing. The gray, or excuse me, the silver colored ones here are vacant properties. So there's an increase over time, but we're still sitting around 250,000 vacant housing units in rural Pennsylvania. And down here, which this should follow closely with the population increase, statewide change in housing units. Again, a lot of this is concentrated in the southeast part of the state, but not exclusively. You can see how many housing units have changed over time, particularly Center County, just over a 3% change from 2010 to 2020. Now, the things that we sort of don't know, and by sort of don't know, we have incomplete information. We have some information, but it's not as granular as we would like. So let's talk about age, because this is also going to make more sense in the context of housing units that we just talked about. We do know how many individuals are above or below the cut point of 18 years of age. And this probably won't seem that unusual to folks who have seen some of our census data before, particularly for rural residents. And we see a gap where the gap between the older and younger Pennsylvanians is widening. So we're having more and more individuals who are over 18 years of age, 81% of the population, and fewer that are under 18 years of age. So we're down to 19% of the population as of 2020 in rural Pennsylvania, compared to a high of 35% in 1960. So there's been a steady decline over time in the percentage of young people in the overall population. That's census data based on the decennial census. So we will have better information in the future. We'll be able to do age cohorts. We're going to be working with the Penn State Data Center to actually do population forecasts out through 2050, but that's at least a year and a half in the making. So it's going to take some time. But based upon our last estimates from the 2010 census, and we're also extrapolating some data from the last available American Community Survey, we can see projections on how age cohorts will change over time. So I'll start here with the line chart, because I think that this helps to summarize a very key takeaway. Rural Pennsylvania is getting older. Now, this isn't just a phenomenon unique to rural counties. It's really a statewide phenomenon, but I want to emphasize the rural one here in this line chart. So the purple line here denotes those who are 65 years of age or older, so our senior citizens. It's increasing projection all the way out through 2040. By 2030, 2040, they should be sitting about 25% of the rural population. So 1 out of 4 residents should be senior citizens based on the last estimates. Again, once we have new data, we'll see how this all plays out. But then those under 20 years of age, it keeps dropping. We were almost at 40% in 1960, but it's been a steady downstream since that time. Now, down below here, we have a series of maps of the Commonwealth. I know these are a little small, but hopefully you can see the trend over time. If it's a shaded county, that means they have more senior citizens than young people. We're at 3 counties that fit that profile in 2011. 2019, 2030, that's our projection there. 2040. So we will have, by our estimates, by 2030, so 8 years from now, 47 of our counties will have more senior citizens than what they do young people. So I'll just let that sink in for a second, because I think that has a lot of implications, particularly for public health concerns, but it affects almost all areas of public policy that you can imagine. It affects education, workforce development, tax base, transportation, housing needs, so on and so forth. So this is really going to be something that many communities need to address. It's not strictly a rural phenomenon. This is, you can see here, this is going to be affecting folks in the Scranton area. It's going to be affecting folks in the Pittsburgh area too. So this is going to be an across the board phenomenon in many communities. Related to this, there are fewer rural households with children and more people are living alone. So just to compare this is 1990 data versus 2019 data. This is the most recent information that we have from ACS here. So in 1990, there are 28% of households that were married couples with children, okay? 28%. That's down to 16% in 2019. So we have a larger percentage of folks who are married with no children, 35% versus 32%. And look at this here, single person households are also up, 29% versus 24%. So again, indicative of a aging population. So these are probably folks who are empty nesters or folks who are just living alone. Maybe a spouse has passed away. There's a variety of explanations, but it fits in line with the aging population phenomenon that we saw. So what does it all mean and what to do? So here's a few takeaways just to keep in mind. So we are going through this period of slow declining population. And this is a long-term trend. So it's not likely to change dramatically in the near term. We are going to keep monitoring any spikes that might have come from the COVID-19 pandemic, where folks from, as I mentioned before, maybe New York, New Jersey, moving into the Northeast part of the state. But that's pretty localized, at least based on what data we have right now. That's certainly not the case in all parts of the Commonwealth. Again, rural Pennsylvania's population is becoming a little bit older. It's becoming more diverse. And the aging population is going to have a lot of implications across the board in terms of policy. But again, this is a phenomenon that many other states are going to be confronting. So I'm a political scientist by training, so I love to dig into policy and comparative politics. So I think there's also going to be some opportunities for us to learn from what other states are doing, what other jurisdictions are doing as well, because this is not strictly a Pennsylvania phenomenon. So what does this all mean for public policy? Well, first of all, don't panic. These are all, this might seem like doom and gloom on the surface. It's not. I think that this is all something that as policymakers, community leaders, folks need to keep in mind that these are issues that have been emerging for decades. And it's going to take some time to address them. Yes, there are significant gaps between urban and rural Pennsylvania, but I think we need to remember that when addressing community needs going forward in light of population change, in light of demographic change, one size doesn't fit all. We have a very large territory in our Commonwealth, very distinct, diverse communities. So we might need to have a localized approach where different approaches work more or less better or worse in different areas. No silver bullets here. So we're going to need to have a variety of different policy approaches. And it's important, I think, that this fourth point, focus on improving the quality of life for all constituents, not just a certain demographic group. If we want to be able to sustain opportunities for all individuals, we can't cater to any one single demographic group. And also keep in mind, rural Pennsylvania has many assets and opportunities, great quality of living, excellent outdoor recreation activities, cost of living differences. There are many, many pluses about living in a rural area. So it's all things that can be leveraged by policymakers to help build the future. And with that, I'll stop my screen share. Thank everyone. And if anyone has any questions in the meantime, happy to answer them. But otherwise, I could always just turn it over then to my great colleague, Lisa Davis.
Well, thank you. As you can imagine, my office and the Center for Rural Pennsylvania work pretty closely together. We're the only two agencies in the state that have the word rural in our name. So we do often get confused, which is, I think, a great benefit to us, perhaps not so much to the center. But as you will see, when I pull up my slides here, can everyone see that? Yes, good. Okay. So let me start from the beginning, and I'm going to make you all tiny. As you can see from some of the slides that I'm going to be presenting here, many of them come from the Center for Rural Pennsylvania because we rely on them for so much in terms of data and information and partnership. So Kyle, thank you so much. And a lot of what I'm going to talk about will build off of what Kyle was discussing in terms of the population changes. But I'm going to be talking also about some of the other issues that we are seeing in rural health in Pennsylvania that mirrors very much what is happening across the country. And I'm going to divert from talking about data and numbers in terms of the census at the very end of my presentation, because I think it's very important also to talk about what's happening in Pennsylvania regarding the COVID epidemic, which I'm sure we are maybe on the end of, but perhaps not yet or ever. So I am the director of the Pennsylvania Office of Rural Health. We are one of 50 state offices of rural health in the country. The State Office of Rural Health program is funded through the Health Resources and Services Administration to be the source of technical assistance, networking, and partnership development across the individual state in which the office resides to really increase access to healthcare services in rural areas and to increase the health status of rural residents. And each office develops their activities to serve their particular state. Here in Pennsylvania, we administer a number of grant programs that work with small rural hospitals, especially critical access hospitals, which are the very smallest of hospitals across the country. We also work with rural health clinics. We work with agricultural producers all across the state. We have expertise in a wide variety of areas, public policy being one, oral health, and so on, also rural population health, and we do a number of other programs, which I could talk about for a very long time, but I will not do that. I would like to say that these are just a few of the potential implications for rural health in looking throughout the next 5 years, the next 10 years, and beyond that. What we are seeing here in the state, and I have some slides coming up that will show this, is that rural Pennsylvania has significant provider deserts, especially when we are looking at primary care, but especially when we are focusing on specialty care, such as dental services, mental and behavioral health services, and so on. We expect that to continue, especially as we look at changes in the population over the next 5 to 10 years. Beyond that, I think it'd be a crystal ball to be able to see what we might be looking at for that. But as we look at changes in population, these provider deserts are, I believe, going to increase regardless of the types of programs that are put in place at the federal and state levels. Right now, we are seeing significant workforce shortages. Every hospital I talk to is experiencing nursing shortages as nurses either leave healthcare altogether or they leave to go work for a nursing agency where they have the ability to make a little bit more money and also perhaps not work such long, tedious, and very stressful hours. And every hospital administrator with whom I speak talks about what the implications for this are for their healthcare facility. Quality of care is not at all being impacted, but they are seeing that they are expending significant more funds on the nursing workforce than they were in the past. This is also trickling out into medical assistants and technicians and other types of providers and staff within hospitals. So we are looking at workforce shortages and really do not see that abating anytime in the future, even though there are programs in place across the state and across the nation that are implementing nursing training programs, working with workforce investment boards to bring nursing and other allied health professions into facilities. I just read today that Penn is launching this fall a tuition-free program for nurse practitioners. So I think systems are trying to come up with ways where they can address these workforce shortages. And here in Pennsylvania, we have 9 medical schools, soon to be 10, when Duquesne University launches their medical school in the fall. So we are not without training programs, but we are a great exporter of physicians, as an example. We also are going to see a decrease in hospital profitability and potential closures. Over the last 15 years or so, there have been about 140 hospitals that have closed across the country. Here in Pennsylvania, we have not been impacted quite as much as other states in terms of the hospitals that have closed. But when a hospital closes, it essentially sucks much of the energy out of the community. Hospitals and the healthcare delivery system are a significant part of the economic driver of communities. It is a way to attract and retain businesses and to keep people healthy in those communities. And when hospitals close, it can be a significant issue for the populations that live there. What we are seeing in Pennsylvania is a lot of consolidation, and I imagine that this will increase over time, not necessarily because of the changes to the census, but because of the complications and the challenges of being a standalone facility in a rural area. Over the 25 years or so that I've been working in rural health, we have seen almost all of the small independent hospitals go into larger healthcare systems. And while there are benefits for those small rural hospitals to be part of a larger health system in terms of economies of scale and being able to access electronic health records and so on, we also are seeing that there are changes that are occurring in the community in terms of access to some services such as maternal and child care. We're also seeing that there will be, I think, as Kyle very nicely showed in his slides, we're going to be seeing an increase in the number of older persons across Pennsylvania. What that means is that healthcare delivery systems and community-based providers will be needing to shift their services to focus on the needs for older persons, to either provide care for them in long-term care facilities or to be able to care for them in their homes, because I think that all of us would like to be able to live out our final years in our home rather than in an institution. We are also seeing across the country a move from value-based care toward value-based care, where we are looking at the specific prongs of quality care, which is cost, outcome, satisfaction, and quality. And so we are seeing that hospitals and other healthcare providers are either being rewarded for value-based care or are being are having values against them in terms of needing to pay back some of the funds that they have received due to not achieving value-based care. We're also seeing a high reliance, what we will be seeing is Medicare as a primary payer, and also in Pennsylvania, as in many states, and I would say actually all states, the Medicaid system is the primary payer of healthcare for older persons, especially for those who are dual eligibles, meaning that they are eligible for Medicare, but they do not have the funds to be able to pay for their Medigap insurance. And so Medicaid comes in and pays those additional costs. We're going to be seeing an increased use of telehealth. If the pandemic has taught us anything, it has taught us that telehealth, it has tremendous potential for being able to overcome in-person access to healthcare. CMS was applauded for relaxing many of the restrictions that they had on what was defined as a telehealth visit. And there's been a lot of advocacy to CMS to continue to keep those waivers in place.
Lisa, there's a question.
Oh, yes.
Lisa.
Sorry, I was not looking at the Q&A. Do you look at data on nursing workforce shortages for long-term care facilities? We look at workforce shortages overall, but I think looking at the shortages for long-term care facilities is really important, because we are seeing that even though hospitals are experiencing challenges, long-term care facilities are really being pinched, especially right now. And we are looking at not only the charge nurses, but also the nursing assistants and others who are providing that care for individuals. So I hope that answers your question. I think the nursing workforce will impact us at all levels of care. The federal government has established several different definitions of looking at what is considered to be an area that is medically underserved. So we have what are called MUAs and HIPSAs, which sounds like terrible acronyms, but medically underserved areas is one component of looking at shortage areas, as are health professional shortage areas. Medically underserved areas look at a provider to patient ratio. That it also includes information on and data on the number of elderly and goodness, my brain is just going dead. This is my 6th hour on Zooms today, so I'm so sorry. My brain's going a little bit dead. But other low income status and so on to determine medically underserved areas. Health professional shortage areas also look at a provider to patient ratio for primary care, mental health, and also dental health. And this is where we really see some significant issues here in Pennsylvania. So these are very nice slides developed by the Center for Rural Pennsylvania. As we look at the rural counties in the state, especially along the northern border and along Maryland, we see that we have a number of primary care HIPSAs that increases significantly when we look at mental health, and dental health is a real challenge in rural Pennsylvania, where we have counties that have no dental providers who will accept Medicaid, or we have no dental providers who will work with patients who are individuals with disabilities, or who will accept Medicare. So these are concerns that I think are going to be exacerbated as we continue over the next 5 to 10 years. Hold on, my slide does not want to go forward. Here we are looking at healthcare providers across a number of disciplines in rural Pennsylvania. Essentially, for every single type of provider, whether it is a dentist or a physician and surgeon or a physical therapist or a pharmacist, we see that in rural Pennsylvania, except for physician assistants, we have fewer providers than we do in urban areas. Much of that is because all the medical training programs are in urban areas, and providers get used to all of the perks that come with being in an urban area. And also there are perks to being in an urban community. You have more access to amenities and to schools and so on. What we are trying to do here in our office and across the state is really to show that rural Pennsylvania is a destination choice. And rather than trying to push providers out into those areas, we want to pull them in because it is such a great place to live and to work. Maternity care is something that I want to touch on very quickly because we have a number of other things to talk about. But maternity care in Pennsylvania is really matching the trend that is happening across the country, where we are seeing maternity care services decline in rural areas. Just as we have the golden hour for someone to receive appropriate care for stroke, with maternity care, it is 30 minutes from the time that a woman goes into labor. She should be able to be in a facility where she can safely deliver. And when we talk about maternity care, we're not just talking about labor and delivery. We are talking about appropriate and continuous prenatal care, and also care for the infant and the mother once they are discharged from the hospital and return home. So we need to be looking at maternity care from the entire continuum of care, because we need to focus on decreasing the infant and maternity mortality rates that we have here in the United States. We are looking at, here in Pennsylvania, as an example, several hospitals that have closed their maternity units when they became part of larger health systems. And patients are referred to the tertiary care facility, which on a map looks like it's very easy to get to. But if any of you have traveled around rural Pennsylvania in the wintertime, even if it's on a 4-lane road, you know that those roads can be very treacherous, and it can be difficult to get there, especially if you live in a very isolated area. Here are the healthcare facilities in Pennsylvania as of 2020, and this is pretty consistent with what we have now. The red dots are the critical access hospitals. We have 16 of those. As we can see, in the most urban areas of the state, especially down in the southeast and over in Allegheny County around Pittsburgh, is where we have the highest number of hospitals, especially tertiary care facilities. We have about 68, sometimes it's 65, depending upon who's counting, rural health clinics in the state, and those are designed specifically to be in rural areas where they can be led by a nurse-led team. So for instance, a nurse practitioner. So as we look at these types of facilities, we actually see that per 100,000 residents, we have higher numbers of facilities than we do in urban areas. But getting to those facilities can be challenging, and we need to make sure that those facilities are well stocked to be able to care for these patients when they come through. One thing that I do want to say is that when we look at quality metrics across rural and urban, it can be challenging to compare apples to apples, because many of the metrics that are used to determine quality of care are not present at the level that they are in rural areas as they are in urban areas. So there's been a lot of advocacy across the country to be able to have separate metrics for rural versus urban. And when that is done, and when you compare across the metrics that are consistent between rural and urban facilities, you actually find that in rural, that the quality care metrics in rural either meet or exceed those in urban areas. We will see over the next 5 to 10 years a change in how services are reimbursed across the state. Right now, employee-sponsored health insurance is the primary payer of healthcare. And as we look across, we see that Medicaid here pays for about 13% of healthcare, and Medicare is about 5%. Even though these numbers are a little bit misleading, because when you look at rural facilities, the payment for healthcare in rural facilities can meet or exceed 20 to 50% of the reimbursement, up to 80% of reimbursement for health services in rural facilities. We will see that either remain steady or increase over the next 5 to 10 years. One reason why that is important is because the Medicare, the public insurers of Medicare and Medicaid traditionally tend to pay less for the same services as do employee-sponsored health insurance. Pennsylvania is the leading state in the country for the enrollment in the Medicare Advantage programs, which is the Medicare MCO program, Managed Care Organization program. And in a number of counties here in Pennsylvania, we have only one Medicare Advantage plan. And so we know that the US is built on competition. If you have only one payer of Medicare in a community, you must accept their conditions of payment because you have no one else. They're not competing with anybody else. So we see that the rural hospitals and rural long-term care facilities will be more at risk of and more financially vulnerable as we're moving forward with individuals who are getting older. Telehealth and broadband is something that we cannot not talk about. This became so apparent during the pandemic when we were looking at the explosion of telehealth services across the country and across Pennsylvania. And what we were seeing here in Pennsylvania is that there is a minimum of 1 million households in our state that have no access to high-speed internet service, which means that not only does it impact access to healthcare services, but it also has impacts when we are looking at education, training, working from home, and so on. So fortunately, through the infrastructure plan that was just passed at the federal level, all states are getting funding to build out broadband. And here in Pennsylvania, we have a broadband authority that has been established, and our very own Kyle Kopko sits on that authority, and he will be a wonderful advocate for making sure that rural Pennsylvania gets the service that it needs and deserves. As an example, we're here at University Park, we're at a major university. Our staff who live 10 minutes outside of town have trouble accessing telehealth and broadband on a regular basis. So if someone in their house is going to school and needs to be logged on all day with their school district, the access to broadband goes way down and they don't have access. Our staff person here was without broadband, any internet access for over a week, and she lives 12 miles outside of town. So this is an issue that is pervasive all across the state, except for places like Philadelphia and Pittsburgh and so on. And I can say that almost once a month, I get a call from a group who is interested in increasing access to healthcare services in rural areas by implementing internet-based services, by sending out iPads or other kinds of technology to rural elderly so that they will access those services on their iPad that is sent to them. And I applaud them for their optimism. There are challenges with doing that are far-ranging, including being able to access that through broadband. I'm just going to skip through this a little bit because we're getting a little close to time and I want to leave time for questions and answers. But as Kyle said, healthcare is an important part of economic development. What we will be seeing here in the state is that we want to make sure that our local healthcare delivery systems are utilized to their full extent so that they can continue to contribute to the economic engine in their communities. So now I'm going to switch for a few minutes and talk about COVID-19 in rural areas. When the pandemic started in 2020, rural America was essentially immune from the impacts of the epidemic because people were not going out. They were not moving within communities. They were not going into large areas. And so they were not really being affected. But once COVID began moving into rural communities, we saw a huge spike. And Ellen Morgan, who's the president of the National Rural Health Association, has been quoted multiple times saying COVID is killing rural America. COVID is devastating rural America, where we are seeing lower vaccination rates. And what you will see in the next few slides is what that has meant both across the country and here in Pennsylvania. So when we look across the country, these are data that I just pulled down today from the CDC, from the COVID tracker. When we are looking across the country over the last about month, a little less than a month, we are seeing that the case rate was going up in rural communities, and which is the green line, and then peaking in October of 2021. And now the case rate is starting to drop while it continues to increase in metropolitan areas. But when we look at the death rate, we can see that it is significantly higher in rural communities and has been starting in October of 2020. And it has essentially not come down during the course of the pandemic. And there are multiple reasons for that. This is something that came from the Daily Yonder. What we are seeing is that as of January, we are looking at the numbers of individuals who have been vaccinated. As you can see, there is a split here between, oh, my cursor just left me. We can see that there is a real discrepancy between metropolitan and rural. Metropolitan is at almost 63% as of January, whereas in rural America, we are looking at about 49%. In Pennsylvania, our rural vaccination rate is about 49%, and it is exceeded by the metropolitan rate of almost 64%. So what is the issue? We have a grant from the CDC to look at rural COVID vaccination and other mitigation strategies. And the staff here in our office who are working on that grant have done a number of rapid community assessments in rural communities. What they have heard when they have talked with the average person on the street is a real pushback on vaccination. People die or they get COVID from the vaccine. There are lots of political reasons for this. And we saw that especially among the Amish and Mennonite populations, where there was a statements that there was one political party that was pushing COVID as false information to try and undermine what was happening with the other party. And so we were trying to send out a lot of information saying, no, really, COVID is real. It is not a political, it's not political myth. We are hearing that people don't know what's in the ingredients. We're hearing that it was manufactured in China. It's not a rural concern. There's concern about women who are either pregnant or want to get pregnant. Will this impact my fertility rates? So we have seen this. We have seen this pushback across the country in rural America and also in rural Pennsylvania. So it's, and as we are moving now through the pandemic and potentially being able to see, hopefully, some light at the end of the tunnel, there's been this sense now, you know what, I never got the vaccine. I don't need the vaccine. So why should I have to think about this? But when we talk with rural hospitals, what they are seeing is that their waiting rooms and their emergency departments are filling with individuals who were unvaccinated, have come in with advanced COVID and say, I want to be vaccinated now. And the providers have to say, we're so sorry, it is too late. They have had to treat patients either out in the waiting room or quarantine them in their vehicles because the emergency departments are full. What is happening across Pennsylvania and across rural hospitals across the country is that the beds are filling up or have filled up with COVID patients, meaning that anyone else who comes to the emergency department or needs to be hospitalized for anything other than COVID may have to wait. So we are hearing lots and lots of frustration from providers who are saying, we've been doing this for so long, it would be great if people would be vaccinated. And this is an old slide. I couldn't find an updated one. So this goes only through October 16th. And the CDC, I think, is no longer publishing this information. But when you look at individuals across suburban, urban, and rural areas, you can see that, especially as of October 16th, we see a higher number of individuals who probably or definitely will not be vaccinated. So that is my doom and gloom for the afternoon. What I can say is that there is a lot that is coming out across the state and also across the country, and that this is in some sense really rural's time. We are hearing more about rural than we ever have in the past. So we'd like to celebrate National Rural Health Day. We are now heading into our 11th year. It will be November 17th, where we are celebrating rural health across the country. And we encourage everyone to pledge the power of rural. And I think that is about it. Here's some more information about our office, and I will stop sharing. And we now have 2 minutes for questions and answers. So I apologize for having taken so long. And for my brain blip. I know that doesn't happen to anybody else, only to me.
Well, thank you, Lisa and Kyle. If anyone of you have any questions, please type them in. So I have an out of curiosity question. When you see that the providers, so you mentioned that the providers see in rural Pennsylvania more and more people coming with COVID into their, right? So like in any of your rapid assessments that you guys did you have any indication, or did you notice that if, say, for example, that for any of the reasons that you've listed, that I'm hesitant to take the vaccine, but one of my family members was affected by COVID and went through a very hard time, does that seems to encourage the rest of the family members to take the vaccine? Do you see a pattern like that?
We didn't get that from the rapid community assessments, but we have gotten that from others, just from general conversations we've had. I think when someone who is directly connected to an individual who is unvaccinated becomes ill or passes away from COVID, that's a real wake-up call to say,
Okay.
hey, maybe we really should reconsider. But there are also those who will continue to be resistant to being vaccinated. So we have answered every single question that people wanted to know. Kyle and I were so thorough.
All right.
Either that or it's 5 o'clock and people want to go home.
Well, thank you very much, Lisa and Kyle. And Lisa, thank you for sitting for the 6th hour.
Oh yeah, I mean everybody's in that stage. It's not just me.
Thank you very much, and thank you, everyone.
Thank you for having us. It was a pleasure. Take good care now.
Bye.
Thank you all. Bye-bye.